Hello, I'm Dr. Harvey Uy from the Peregrine Eye and Laser Institute in Makati City, Philippines. And I'm excited to talk about a new age of high contrast, wide range of vision intraocular lenses. In the past years, there's been a growing trend towards having good distance and intermediate vision uh, for patients who are undergoing cataract surgery. And a successful cataract surgeon is able to understand their patient's needs and has a bunch of solutions that can help address the patient's concerns and give the patients the kind of vision they want. As we transition from the age of print to the age of digital devices for gaining information, having the ability to be able to have high contrast vision for seeing distance as well as digital devices becomes increasingly important. And this trend has been accelerated by the pandemic, making patients and people shift to a more digital way of life. For example, patients are now able to access their doctors by using telemedicine. Students are able to do online learning. Office workers are able to work at home and interact with their colleagues using online digital devices. And we're even able to shop and order food digitally without having to leave the house. So in this current age, if we cataract surgeons can give patients very good spectacle-free distance vision and good intermediate vision so that they can see their digital devices without glasses, then our patients will be very happy. And I've noticed a recent trend that patients are willing to sacrifice wearing reading glasses for the occasional fine print as long as they can be assured that they can see their laptops and their smartphones very well without glasses. To address these needs, Teleon has introduced a new breed of intraocular lenses called extended depth of focus intraocular lenses, particularly the Acunex Vario lens. This is a one-piece foldable lens which is made of glistening-free hydrophobic acrylic material. It's blue light filtering. It comes with a C-loop haptic which provides excellent centration, and it has a 1.5 near vision segment, as you can see in this picture. Incorporating this lens into your practice requires no learning curve, as the lens can go through implantation through a 2.2 millimeter clear corneal incision. Once inside the eye, I really love the way the haptics unfold in a controlled manner, allowing you to manipulate the lens with the lens still staying inside the capsular bag. Once the lens has completely unfolded, the haptics provide excellent self-centration, which is persistent in the post-operative period. We were fortunate to participate in one of the early pilot studies of the Acunex Vario lens. And in this study, we implanted 20 patients bilaterally with the Acunex Vario lens. We had the familiar IOL study endpoints shown here. Patients were typical cataract surgery patients without other pathologies. And the characteristics of the patients were what we would typically see in patients coming to us for cataract surgery. And these patients were sort of a maybe slightly younger age group, if you can call 70 years old young. But these patients are still very active and they like to do some sports. Some of them are still driving, and some of them they like to read or communicate with their friends and colleagues using their computers or smartphones. These are typical surgical parameters that we used in the study. How did this Acunex Vario lens work? So from our experience, the patients demonstrated excellent monocular uncorrected distance and intermediate visual acuity. Of note, you can see that the results for intermediate visual acuity that's uncorrected is almost as good as the uncorrected distance vision. For near vision, when these patients were uncorrected, you can see where they were just below the threshold value for reading. Now, a lot of these patients were slightly or mildly hyperopic, and when we corrected this small amount of hyperopia, you can see here that we retained excellent distance and intermediate visual acuity, but you can see that now a lot of the patients are able to demonstrate good near vision acuity as well. How about binocular vision? So implanted in both eyes, these patients now are able to demonstrate excellent uncorrected distance visual acuity, and amazingly their intermediate vision is almost as good as their distance vision. And surprisingly, a lot of these patients also reported that they're able to read near without using spectacles. From this image, you can also see very tight, consistent, and precise refractive outcomes after implantation with the Acunex Vario. These two graphs show you the defocus curves at 3 months and at 6 months for monocular and binocular vision. And what's very impressive about this graph is that these patients demonstrated a broad, wide range of continuous visual acuity through different distances. And this seems to be superior to the bimodal curves that we would see with multifocal lenses. So in contrast to placing your standard multifocal lenses, these patients are able to see continuously over a wide range of distance, and this is of some advantage when you're working in the office and you have to look at somebody who walks into the room, look at your laptop screen, and then try to find something on your desk. So this continuous range of vision allows you to be more efficient working. How about patient-reported outcomes? Well, we also tested the contrast sensitivity, and we found that these patients demonstrated excellent photopic and mesopic visual outcomes with good contrast sensitivity, whether it's in light or dark conditions. We also purposefully asked patients about visual disturbances, and we were pleasantly happy to see that very few of these patients actually reported glare, halos, or starburst, whether it was day or nighttime conditions. So in general, the vast majority of these patients were very happy with the quality of vision after surgery. So the key findings from our initial series of Acunex Vario patients were the Acunex Vario is very easy to handle and very easy to implant, and there's a very small, even no learning curve to incorporating this into your practice. It centers very well inside the capsular bag, which is important for a lens with advanced optics such as the Acunex Vario. We're able to get good refractive predictability right off the bat. The lens exhibits excellent visual performance for distance and intermediate visual acuity, providing patients with a continuous range of vision. And surprisingly, a lot of these patients were able to obtain good near vision when implanted binocularly. There were no significant patient complaints about visual disturbances. So in summary, we found that the Acunex Vario provides a wide range of continuous vision, and similar to a monofocal lens, is very well tolerated with little to no visual disturbances. Thank you very much for your attention.